So my name is Courtney Bowie.
Hi, my name is Darsana Srinane Smaran.
Hi, my name is Chantal Calero, and today we'll be interviewing Andrea Templin, a registered nurse at Dell Medical School. Andrea is currently a health access nurse who overlooks the Access and Outlook Center. In the interview, she will be answering questions about her undergraduate and her profession.
So I went to UT for school, and I did the nursing program at UT, and then I started my first job straight out of nursing school was working in the NICU here in Austin. So had the ICU experience for a year and a half, worked nights, and then I switched to this job. And what I do now is I'm a triage nurse on the phone, so I talk with patients over the phone, whether they just had a surgery or they're getting surgery or they feel like they're sick. I'm the one they talk to. A nurse? So I come from a medical family. Everyone in my family is a doctor or a nurse or a PT, so I don't really know anything else, but I've always loved it. My mom was a nurse and kind of like instilled those values in me, and of caring, compassion, and it just kind of like felt like the right thing to do. So my typical day in the ICU was actually a typical night because it was 7 to 7 overnight, and it was definitely fast-paced, and you're just trying to like put out all these fires all the time. And my day now is clinic hours, 8 to 5, Monday through Friday. We don't work on the weekends here. And, you know, in both settings, I deal with patients and whatever problems come up. But now it's over the phone, where it used to be hands-on the bedside. So. I had a social life. I was just very tired. I had the social life. Yeah, no, that was definitely a hard part. But, you know, you bond with the nurses that you work with, and they can kind of become your like social life and also your support system, because they know exactly what you're going through, and yeah, I mean, you make it work, you know. So I usually work 40-hour work weeks, just like normally would. When we do the 12-hour shifts in the hospital, it's a 36-hour week, but they round up just because of how hard you work. They don't make you come in for 4 extra hours. 40 hours a week here, and people get sick throughout the year, so there's no busy season. I mean, sometimes like Christmas, sometimes a little bit more of the holidays, but it's year-round. Teamwork is huge. Teamwork is the only way that you can get through your shift, honestly. Especially if someone's in, you know, a crisis, whether it be a patient or another nurse who's just overwhelmed. To be able to rely on other people is and also to know that you can help out other people, and they're, you know, gonna help, like, tell you how you can help them best is critical. There's definitely some people who, being a nurse, we tend to be a little bit type A and like to have things our own way. So sometimes there's a little bit of, you know, tension from that, but you usually know who's like that, or if you're like that, you can kind of preface it, and it usually works out pretty well. One really important value is to be pretty chill, or have, you know, cool under stress, whether that be so that you don't show your patient that you're freaked out, or just to try and help, you know, any situation, and also for your own mental clarity of like, what do I need to do right now? You kind of like go on autopilot, you do what you need to do, and then the people around you have like a better environment. And another thing would be patience, with whether that be like educating patients or their family members, or other nurses, or just situations where you're like, I just left your room and now I have to come back for the same thing. Just, to be able to have give the patients the best experience that they deserve. So I work with nurses, both places, work with doctors in both places. I think the pace of the day and the things that I do, I don't work at the bedside anymore, so I don't do IVs, I don't do, feedings for the babies, and I don't do all those kind of technical skills that I do, and now it's more patient education and talking to the doctors of what they want to do, or what they, how they want me to help the patient while they're busy during their clinic day. Yes. Mm-hmm. Yeah, I got into the nursing program they used to do it differently, where you kind of went into pre-nursing, and then you had to reapply to the nursing school after your freshman year. So I did that and got it then. Yeah, the nursing program is pretty competitive. There are a lot of type A perfectionists in nursing school. So I think just being able to have the perspective of, this is school, I'm going to, try my hardest, but also not being caught up in it. A lot of times I wouldn't study right before the test with everybody. I would get to the test right when I needed to, so I didn't have to deal with the chaos of people cramming last minute. I just needed to know my material and go in there and just know you're really a team, and you realize that more when you get into clinicals than when you're just competing in the classroom, that you just kind of need each other for help. And so yeah, that's it is competitive. It was, UT does a great job of educating, I think. All my science classes were really critical, biology and physiology, and I remember I had great professors for all that. Psych professors were awesome. And then in nursing school, all the clinicals and all the experiences and classes that we had, that's, what trained me to do my job. So yeah, it was. Be tech or something. So I did not. I spent a day shadowing somebody in the NICU when I was in high school, and I fell in love with it. I know a lot of people volunteered in various, in different settings in the hospital throughout the summer, or did, an internship, or were just kind of there as a helper, comfort, kids hospitals and stuff. And they loved their time. My schedule in college didn't work out that way. I think having the experiences in different types of medical settings, just so there's such a vast variety of options that you can be a nurse in. You can be in the hospital, you can be in a surgery center, you could be in a primary care doctor, you can be a home health nurse. There's so many options, and just to have kind of little tastings of those to see if you fit in anywhere, or what you like the best, because some people think oh, I love kids, I can never work with adults, and then they work with kids and they're like, oh, no. And so I think that that's pretty important and pretty beneficial. So I was in a sorority, a Greek sorority, and I was in the honors program in the nursing school, so those kind of took up my time. I think, I don't know how much the responsibility change, what our scope of practice is, will change a whole lot, but I know there's a, increasing demand for advanced practice nurses and just nurses in general. There's a shortage kind of everywhere. Everyone's like, oh, wherever you go, you can get a job, and it's very true. So I definitely think there's a high demand. I think it's a great field to go into because you do have so many options, and you can go down one direction. Like I was in the ICU, and then I'm now here, and then I may go on and go back to school and get my nurse practitioner. So and work in like a different setting altogether. So it does have a lot of different ways that you can go, and you never pigeonhole yourself, which is cool. I guess I addressed that. So I'm gonna go back to school. I miss the technical piece of being with the patient in a room, and I've had a lot of great experience with the different specialty clinics we have here at UT Health Austin. So I want to combine those two and go back and become a nurse practitioner and work in a clinic, so I get kind of both things. Yeah. It's emotionally taxing. I think about my patients when I go home, and everyone's like, oh, you have shift work and you don't have to, you don't emails at home like some finance people do. You're not always catching up on things, but you think about them, you want to check up on them when you come back in. If you're in the hospital, I always want to see how they did during the day. And here, whenever I get the checkup on them, the doctor wants me to call them in a week. I love hearing their progress, and so you definitely get invested, even though it is just shift work.
Do you have any?
Let's see. I think if you want to do it and you have the heart to do it, and you like helping other people, that literally is your job. You give sometimes all that you think you can give, but it's so rewarding. So I think my advice would be if you want to do it, go in it wholehearted and give it all you got. Don't do it if you just think, oh, it's a good job, there's job security. I think that's not going to get you through any job. So. I want to share that I could share. I remember from when I was in the ICU, I just had a few really special families that I just connected with, and we're still, still friends, and we went through a lot. I mean, they had sick babies, and I took care of their babies for a month, and I don't know, they're just memories that warm my heart, and they make me if I'm ever having a bad day, I can look back on those and be that was special. That's why I'm here.
That's it. Thank
That's
you
it.
so much.
Yeah, of course.